So what happens after perimenopause? I get questions like, well, I've been in perimenopause for years, and so when does it actually end? What happens after? I hear this quite frequently, and honestly, it is such an important one because most of the conversation starts and centers around perimenopause. Nobody really talks about what comes after. So let's talk about it. I am Milca. I am a nurse practitioner in primary care, and these are the conversations going on in my office. Menopause itself is actually one single moment in time. It is the point when you've gone 12 consecutive months without a period. That's it. That's the definition. The day you hit 12-month mark, you are considered postmenopausal. And I think one of the biggest reasons women feel off guard after menopause is because of the way we talk about perimenopause in the first place. Everything is framed around getting to menopause, almost like it's the finish line. Like once you get there, the symptoms stop, everything balances out, and you just go back to feeling like yourself again. So when symptoms continue or completely new ones come up, women often think, wait, am I doing something wrong? Why do I still feel off? Why did nobody tell me this? And the truth is, nothing is wrong with you. You just weren't given the full picture. Now, I want to say this clearly. For many women, menopause does bring the relief. The unpredictable periods stop, hormonal roller coaster settles down. A lot of women describe feeling more emotionally steady, more clear-headed, more grounded than they have in years. That part is real and deserves to be talked about too. But postmenopause also comes with its own set of challenges and changes. And these are the conversations women deserve to be having with their healthcare providers and doctors, because estrogen does not only affect your period. Estrogen is a whole body hormone, and when your estrogen level drops, stays low after menopause, you may notice things like vaginal dryness, pain or discomfort during sex, urinary frequency, urinary symptoms, more UTIs. There's actually a medical term for this. It's called the GSM, genital urinary syndrome of menopause. Incredibly common, incredibly treatable, but only if someone tells you it even exists as a condition that can be treated. You may also notice changes in your sleep. For some women, hot flashes and night sweat never goes away. It continues. For others, sleep becomes lighter, more interrupted, less restorative. Mood and energy can shift too. Some women feel more like themselves than ever. Others notice lower resilience, less motivation, or even less sense that something feels off, slightly off, even if they can't fully explain it. You may notice changes in your skin, your hair, your joints. And then there are the two things I really need women to understand: your bones and your cardiovascular health. Before menopause, estrogen protects bone loss and heart disease. After menopause, that protection changes. Bone loss accelerates. The first 2 years after menopause is when you lose the most bone. The risk of osteoporosis increases significantly. And cardiovascular disease becomes the number one cause of death in women after menopause. Not cancer, heart disease. And women are not being educated about this nearly enough. I'm not telling you this to scare you. I'm telling you this because these are the things you can actually do something about, especially when you catch them early. This is why it's very important that you talk to your doctor or your healthcare provider about these issues. Bone density screening, blood pressure screening, cholesterol screening, strength training, nutritional, sleep. And yes, for some women, hormone therapy may still absolutely be a good option. These conversations matter because here's what I really want women to understand. Postmenopause is not the beginning of decline. For many women, it becomes one of the strongest, healthiest, most grounded chapters of their life. But feeling good in these stages does not happen by accident. It happens when women finally have the right information and providers who take their symptoms seriously instead of dismissing them as just aging. You made it through the transition. Now you're in the menopause. Now let's make sure that the years ahead are actually feel good. If this helped you, follow along. Every week I'm here sharing honest, straightforward information about menopause and midlife health, because women deserve better conversations than the ones we are having right now. I'll see you in the next video.